Hi everyone! This course is about clinical kidney transplantation. Since the kidney plays a central role, it's important to learn about the structure and functions. After this lecture, you will be able to answer the following questions. What is the anatomy of the kidney? What are the functions of the kidney? What are the symptoms when kidneys fail? How can we investigate renal function? And why do kidneys fail? Let's first look at the anatomy. The kidneys are a pair of organs located in the back of the abdomen. In adults, each kidney is about 11 to 14 cm in length. The kidney is composed of an inner medulla and an outer cortex, surrounded by a tough fibrous capsule. Each kidney contains around 1 million units, called nephrons, the microscopic filters for blood. Each nephron is made of a glomerulus, proximal tubule, loop of Henle, distal tubule and a collecting duct. Here you find a microscopy of the kidney, with the glomerulus, tubules and a vessel. The nephron carries out nearly all of the kidney's functions. Most of these functions concern filtration, reabsorption and secretion of water and solutes. So what are the 5 major physiological functions of the kidney? Well, excretion of waste products and drugs, maintenance of water, electrolyte and acid balance, production of hormones, including renin to regulate blood pressure, EPO for red cell blood production, and conversion of inactive vitamin D to active vitamin D, of importance for bone metabolism. When kidneys fail, symptoms are related to disturbance in the functions. If you recall these functions, can you think of symptoms? So pause a moment and write them down for yourself. The symptoms include accumulation of waste products, which causes various symptoms, including malaise and itching, fluid overload and electrolyte disturbances, enhanced blood pressure, anemia, and bone disease. So how can we measure renal function and investigate renal disease? The serum level of creatinine, which is an endogenous marker in the body, is most commonly used as an index of kidney function. Glomerular filtration rate, or GFR, describes the flow rate of filtered fluid through the kidney. Clearance is the volume of blood plasma which is cleared of creatinine per unit time. Urine tests can show how efficiently body wastes are being removed. In addition, it can be used to screen for many factors, including protein, blood, pus and bacteria. Imaging tests such as CT and ultrasound, as shown here, can be used to look for structural abnormalities and obstructions. As an example, when there is an obstruction, you will find hydronephrosis, which means swelling of the kidney due to a buildup of urine. A renal biopsy is performed by using a thin needle with a sharp cutting edge to obtain a small piece of renal cortex for microscopic examination. Ultrasound is used to locate the biopsy place. With a renal biopsy, specific disease processes and its response to treatment can be determined. Renal failure can be acute and chronic. Acute renal failure is a clinical syndrome denoted by an abrupt decline in renal function in days to a few weeks. It can be classified into pre-renal causes, such as a low blood pressure or heart failure, renal causes, such as glomerulonephritis, where the disease is located in the kidney, and post-renal causes, such as obstruction in the urinary tract system and from outside. Kidney disease can also be chronic. Chronic kidney disease, or CKD, is defined as either kidney damage and/or GFR below 60 for more than 3 months. There are 5 stages of CKD. Patients with stadium 5 have end-stage renal disease, an estimated GFR below 15, and are likely to need renal replacement in the short term. Diabetes and hypertension are major causes of CKD worldwide. and CKD is an independent risk factor for cardiovascular disease. So what should we learn from this? We've learned that the nephron carries out nearly all of the kidney's functions. Renal functions concern filtration, reabsorption, and secretion of water and solutes. Renal investigations include serum, urine, imaging tests, and renal biopsy. And it's also important to remember that diabetes and hypertension are major causes of CKD. In the next lecture, we will discuss options for the patient if kidneys fail.